which is why I think a lot of my colleagues are understandably afraid of cats because their learning history is, I learned this one, I wouldn't even call it technique. I learned this one thing that escalates fear and stress.
Yeah.
My learning history is these cats appear to be upset out of nowhere, which is not the case.
Yeah.
But also, I understand why you're unsure and conflicted. You haven't been given tools. When I'm like, there's 40 things I could do with this fearful cat to make this less stressful and more efficient.
Welcome to the Purr Podcast, your favorite feline-focused podcast, where we dive into all things feline. Medicine, surgery, behavior, and of course, a sprinkle of veterinary gossip along the way.
I'm Dr. Jolle Kirpensteijn, feline fanatic, surgery nerd, and self-proclaimed lover of all things awkwardly cat-related.
And I'm Dr. Susan Little, proud cat vet, podcast enthusiast, and your guide to the wonderfully weird world of feline medicine. Let's get started.
Hi, this is Dr. Susan Little.
And Dr. Jolle Kirpensteijn, this is the Purr Podcast. Perfect.
You think?
Perfect.
Did I nail it?
You nailed it.
Like a 10 out of 10? Ish? 9?
9. Niner. 10 is, it's difficult to reach.
Oh, I see.
Right.
Um,
And I have a story there because when
I love stories. I'm
Right.
excited.
it is very difficult to get an A in the Dutch school system. We don't do A's anyway, but it's like a 10 is the highest that you can reach, and it's impossible. So then you come to the US and everybody expects you only to score A's,
yes.
because otherwise you're, this whole system is business. So it was very difficult when I came.
So that's
here
your whole story?
That's
it?
That's
a big
interesting.
difference. Yeah, it is interesting. So,
Because 10 out of 10 is like perfection, which
Right.
isn't really a thing.
I
and
really thought there was
that
more
goes
coming.
back to that niner that you got. So you
Okay.
should be really happy with that.
I'm very happy with it.
Thank you.
And
First time in our life. We have a wonderful guest today.
yes, we do.
And
One of the few vet techs. We are always looking for vet techs to bring on, and we haven't had one for a while. I
no,
don't
we
think.
haven't. We haven't.
So we were so thrilled that
We
you
were
agreed to
thrilled.
come on with us. So we will let you introduce yourself.
Yes.
My name is Tabitha Kucera. I am a veterinary technician specialist in behavior, a certified cat behavior consultant, and a Care and Prior Academy certified training partner. If you can't tell, behavior is my jam. I also own a behavior and organizational consulting business called Chirps and Chatter, and I see cat and dog behavior severe cases, but then I also have the pleasure of consulting with organizations on how to implement feline friendly handling, fear-free handling, and also how can we make that environment less stressful? And also how can we help our patients and clients address behavioral issues? Because you probably know too, it's actually what got me into behavior as a tech. There are very limited resources for cat behavior, but it is a very big need.
Yeah.
And we know us vet professionals have to do everything. So
Absolutely.
I've already learned we don't have to ask any questions. The question just goes for it, without even the first question. We're there. So wonderful to have you.
Yeah.
So thank you.
thank you for having me. I'm a huge fan
Oh,
of both of you. So
thank
this
you.
is, I'm not intimidated at all.
Okay. So, I'm sure
We make it
little
easy.
heart right there. And Dr.
Behavior.
Susan has a new haircut, for instance, and so it looks
It's
great.
not a new haircut.
Oh,
It's the
okay.
same haircut.
Right?
Men, they, what can you do with them? Really?
Looks really good. That's what I
Thank you.
tried to say.
Thank you.
Because,
Because
when
you were about to say,
when we-
you have a new haircut and it looks really good. And if you're
That's
a-
what he was
right?
gonna say.
and if
I-
you're a woman, the subtext there is whatever you had before, girl, wasn't working.
Okay, so that's why I have to tell my story now, because normally when we take a picture, every
Yes.
time she says, "Oh, my hair's not good,"
Because it's sticking
and so
up.
I have to warn her like 3 times in advance
'Cause it's
before the
sticking up.
picture.
It's not sticking out right now.
Hair, and hair,
Yeah.
and then she says, "Oh yeah, hair," and then she does a little thing, and so you look really good.
Thank
So
you.
he's doing check-ins, it sounds
Right,
like,
thank
to
you.
help. But also
I
I can understand where you're
support-
coming from. See, I'm a both.
We may need her along all
Yeah,
the
yeah,
time.
for
Behavior, it's a lot of
Yeah.
mental,
Yeah.
with caregivers.
Subtext.
Yes.
for our future podcast, you should sit there and then say,
I would focus on what behaviors I want
Right.
and reinforce those.
Right.
Yes.
Not punishing.
you have a little
Exactly.
clicker. Yeah, you
Exactly.
click
There
right.
is training for humans. It's called
Right.
Gag Teach.
I think it's a really good idea for Dr. Susan.
Yeah.
Right. Yeah.
I'm taking it all in. So I want to roll your story back to
Behavior.
why veterinary medicine? Where did you go to school? So
Yes.
Let's hear a little origin story from you.
Long story short.
Yeah.
So yes, I was one of those kids who grew up with tons of animals. I grew up in a lower income area, so understandably there were stray animals everywhere, and my mother and siblings are amazing. So yes, we took care of all of them, and that's where the seeds were planted. And I love veterinarians, but I did not want to be a vet when I grew up. I wanted to be actually wasn't sure in high school. I was an angsty girl.
Okay.
Didn't dig high school, which now I understand because they aren't environments conducive to learning and lots of other things. Like in my early 20s, I was one of those weird people who knew what I wanted to do. And it was like, I want to be a vet tech. I went to Stotzenberger, but prior to that, I worked in boarding facilities and in animal welfare. So I had that experience, and I still work in animal welfare. I was lucky. I loved everything about being a tech. I worked in GP for about 12 years.
Wow.
And in that time, I started working with cats from a behavior aspect. First, I work with cats and dogs now. And I'm super fun, but what kind of led me on my path to behavior is, one, I met the amazing Sophia Yin. Because my first interest was, what can I do to decrease the stress of my patients? It stresses us out. And I do have very strong feelings that I don't feel like handling is treated as a skill in our field.
No, it isn't.
I really wasn't set up for success. Like the tools that I was given, I have not used in quite a long time. I started learning through her. And in that process, I started understanding body language better. I was the tech that got called in with every fearful cat and dog.
Of course.
And then in that process, I also met a lot of caregivers. By the time they brought their cats to the vet, their cats were ill for a very, 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 very long
This is
time.
so common, yeah.
And the most humane thing to do in that context was to peacefully allow those animals, help them pass.
Yeah.
And that was something that's challenging for us as veterinary professionals, caregivers. And it wasn't, these caregivers weren't malicious. People always say cat pain is subtle. I always say it actually screams out at you. It's
If
just,
you
we need
know-
to.
You know what to look for.
Yes, we
Yeah.
need to identify. In vet med, we love asking why. We're nerds. I love it. So I was like, why is this happening? And then also lots of behavioral issues where many cases cats don't even see us. The caregivers open the door or call the shelter, right? So I was like,
give it away.
why is this happening? I, as a vet tech, we all have lots of more resources than the general public does, that even in animal welfare. And I was like, and this was like, 10 years ago. And I'm like, there are not very many evidence-based animal welfare positive behavior resources, and I have access to more stuff than other people do. And then brain lit up, and I was like, I love behavior. I need to help caregivers. I need to help see more cats at the vet. I need to provide solutions and management for cat behavior issues and prevention. And that kind of led me down my path of becoming a certified cat behavior consultant, becoming a care and prior certified partner, and then also, we all know that we're perfectionists and super extra, which I love about us. But I was like, I'm going to get my VTS, and I got it in general practice. So to all my techs out there, I commonly hear us shutting ourselves down. It is more challenging, but you can totally get your VTS and GP.
You know, to this moment, even if you look at, say, scientific studies that are published every year, very few of them are on cats, and the number of them that include cat behavior, you can probably count on one hand to this moment. And I think it's partly because it's hard to study if you're taking the same approach as, does this drug work for that disease, right? And we just don't have enough behaviorists and behavior consultants. You were saying that vet techs definitely can do the VTS general practice. Why is it considered difficult? Why do vet techs think it's difficult?
Every specialty is different. Obviously, they're all very in-depth processes, but from the behavior aspect, you need over 3,000 hours of treatment and prevention hours. So treatment is with the vet's diagnosis, and prevention is, I'm going to talk to this client about helping address destructive scratching and focusing on what we want, identifying, making sure the cat's needs are met, and ideally avoiding declawing. But it can be challenging because if you're working for a veterinary behaviorist, you're getting so many behavior cases. And also they're really familiar and amazing at behavior, because behavior is not something we all learn or know really well. We all know our things. So it can be a little more challenging in GP due to that. And then finding mentors can be, I mean, I'm sure we can all relate to that, can be a bit challenging. But once you have that, and to be fair, I worked in GP and I got so many hours every day because understandably, once we start to identify behavior problems and have tools to help, everyone's like, Tabitha, like so it was very easy, but I also had to get the education because the VTS process is very self-paced, which does make it challenging.
Right.
So when it comes to it being more challenging in GP, I think it's because with veterinary behaviorists, which is also amazing, they are providing mentorship and that's all you're seeing is cases. So those diagnoses are easier.
Right.
But I do hear a lot, people they kind of text are just like, I can't do it. And I'm like, yes, you can. You don't have to, you could just learn more about behavior, which is also awesome.
Can I ask a question because I'm a little confused? So you can do your specialization in behavior as a vet technician, both either with the behaviors or in general practice.
Yes.
Okay, so that's why you did you do the path with the general practice or did you do the path with the behavior?
Yeah, I did it in general practice.
General practice.
Yeah.
So, and that's your message to other technicians that, you don't have to be with the behaviors to do this track as long as you focus on behavior cases.
Right. And behavior is easy to find.
Like
it's everywhere.
You can easily become like the Tabitha in your practice, right?
Because that.
But it's true, right?
Yeah.
Like practice is often, she does that, So if you just become the Tabitha.
Just like there's the awesome nutrition tech, or there's the awesome vet that's really into rehab.
Exactly.
We can all learn from each other.
Exactly.
And that's why I miss working as a team. But
and we just learned, we had a guest that was talking about urinary disease, and the most important part of that was the intake intake interview that can take
like
up
the
an
history.
hour, and that's where a veterinary specialized technician can really help because that is what you do.
Yeah, and that's something where you can obtain an in-depth history, and then also we find ways to obtain that very quickly. I'm sure you talk about this all the time, but I tell, because whether I'm working with a caregiver, because I teach them what pain looks like. Every caregiver I work with gets medication training. That's a whole separate thing. But also I say, no matter who your veterinarian is, in many cases I'm working with them, but every exam should include videos. And just seeing a video of a cat house soiling or even using the bathroom is just that alone gives me so much data in a very short period of time. And the awesome thing is everyone has smartphones now.
Yeah. And they may already have video on their phone. They just don't know that it's useful. Like you're thinking of pain, right? So I often ask owners to show me videos of their cat that I suspect is arthritic, but because, in the exam room, they won't do anything. And so, I'll have them just when their cat's just doing whatever, walking up and down the stairs. So I think they do this. They just don't know the value of what's on their phone.
And clients will say, and also, let's be honest, clients should be, we need them to be a part of the care, but it's also really reinforcing to them. Every time I ask, because I talk about it, every cat I work with, no matter what, I get videos and they're like, let me show you. And they get so excited.
They do.
And also, honestly, you touched on it where I say chronic pain is really hard. You have to go to 20, let's say you're in human medicine. Hopefully all you people suffering with chronic pain, I see you, but you have to go to 20 doctors who all are in the field because they care about humans. You have to advocate for yourself. And I always tell people, your vet's amazing, but your vet doesn't have your cat walk up and down the hallway, as they should not in most to all cases. And also fight or flight affects pain response too. So between those two things,
we don't see natural behavior.
Yeah, it's really challenging. And then again, the amount of pain I probably see in my cat cases 80%.
Right.
It's
so often undiagnosed.
But it's hard. I also recognize it is challenging. And we're talking more and more about this in CE, which warms my heart. We need the caregivers. And also, you need the caregivers. It's going to make your job as a veterinarian more easily to diagnose things, more easily to manage. Because once we diagnose the pain, that's awesome. But we need to reassess the pain.
Yeah, it's not one and done.
And we need data because so many times, whether it's anxiety meds or pain meds, the client, I used to be this tech, right? So I learned, and I used to call after dentals with extractions. how's the pet doing? Because I was a surgery tech, and I used to accept the answer fine, and that hurts my heart now.
Yeah. Well, you don't know,
Because
you didn't know what you didn't know, right?
and clients don't know what pain looks like. So yeah,
Exactly.
and also could those clients, because in many cases they come back for the recheck, they
Mhm.
had extractions, and caregivers didn't give the
Mm.
pain meds,
Right.
and
Because they didn't think the cat needed it.
yeah, because they're like
They're
that
fine.
F word. They're fine, or they couldn't give the meds, and I'm a huge advocate for cooperative care with cats because that's another thing that I think we all struggle with in vet med.
Yep.
And there are solutions. I say meds, my cats come running and open their mouths. And I teach this to other caregivers because you're the most amazing vet, you diagnose it, but if the caregiver can't give the meds,
Right.
I mean, there's so many
all
challenges.
Have you seen the Felix app? So it's
Oh wait, that's not the Sylvester one.
Sylvester, that's the name.
Oh, cool.
Why did I
Okay.
say Felix?
No,
Yeah,
see,
so-
but you got me there.
Sylvester, that's it.
Yes, I have
Yeah.
seen that one.
So that gives me hope, right? That
Yeah.
if we can see some apps that are, what are you looking at me like? that
No,
for?
it's okay. I just was communicating with my audience on the YouTube channel
I see.
that yeah.
We talked to the camera.
That we're leaving you out?
No, not at all. I was just responding to your Felix app,
I see.
which
You can't let anything go by.
Oh, I love you guys. You guys
So
but yes, I have.
that gives me hope, right? Because that puts tools like facial recognition of pain faces into the hands of owners. That's right. That's what I like.
Yeah, and
Yeah.
I'm sure in vet med, it's beautiful. We have seen even though I can understand how we focus on the challenges as humans, that's kind of what we're conditioned to do. But we've seen so much progress in cat medicine,
Yep.
which warms my heart. People wanting to learn about cats, which really warms my heart.
Yeah.
But also, like you said, more resources that are accessible. Like I work in animal welfare and we do fear, anxiety, body language scores and pain scores for every cat every time.
Right.
And people are like, but I'm like, I'm doing it in animal welfare. We could definitely do it in vet med. And those tools are so powerful. It's just, we have to train our staff on those tools and not just say, this is the pain score we're using. Not that I
Yeah.
ever see that happen.
Right, exactly. Yeah. So why did you leave practice?
Ooh, heavy crap. No, I'm just
Like
kidding.
why and when?
yeah, let's just drop it right in.
Yeah. Yeah.
Thanks.
Yeah.
Thanks, Susan.
Listen, we're known as a hard-hitting journalistic podcast.
I
We have,
wanted to ask a really nice question.
we have
Just-
standards.
Susan dropped it right
Of
there.
course.
Go ahead. What's okay?
So I love GP. And I worked in GP for a very long time and I was
Right.
very thankful. Every practice I worked at, I was kind of the cheerleader and the implementation to implement more feline friendly handling practices
Yep.
to do substitute and declawing and offer other things. But in my process of learning more and seeing, I was a surgery tech at every amazing clinic I worked at.
Mhm.
But then what I touched on, Tabitha. And I was like,
yeah.
people are, I was like, this is interesting. So I learned more and more and more because I have imposter syndrome like all of us do. And I was like, I can't start my own business. And also what? I have the behavior skills. I have the communication skills, but like business is a whole thing. So that was also really scary.
Right.
But then I was like, this is a need. And also, I'm going to be honest, I think human mental health is as important as animals. And I talk about it a lot. I was struggling a bit in vet med for lots of reasons.
You're not alone.
Yeah, for lots of
Right.
reasons. We've all been that person like crying in the bathroom. And that's data. Now that I'm like, therapy's cool, behavior is cool. I'm very aware of my emotions. Like if I'm really grumpy, I'm like, when did you eat last, girl? And those are things I never used to ask myself.
So happy you say that. I'm so happy you said it. Thank you. Once again.
So that was a big, and honestly, I think we all struggle with this, but I think I was like, am I still a tech if I'm not in GP? Which is,
Oh, well, it's a valid question in that non-practice roles for techs is still evolving. It's
yes,
still unusual,
very much so.
right? So,
So I struggled with that. And then, but my job, I mean, I still work in GP, PRN. And then I also deal with high fear, anxiety, and stress patients. So patients who many cases have been fired from vet clinics, who exhibit severe fear, aggression, cats and dogs. So it's really cool because I work with those patients and I get to help consult
you-
at the vet and then leave.
So they call you in then for those patients?
Yes.
They say, we have a patient, would you like to take a look at it?
Because that's a separate skill, right? I mean,
It is.
you know, I'm a nerd with handling, and I do truly feel we aren't really taught it as a skill, and we're kind of set up to fail, which is why I think a lot of my colleagues are understandably afraid of cats, because their learning history is, I learned this one, I wouldn't even call it technique. I learned this one thing that escalates fear and stress.
Yeah.
My learning history is these cats appear to be upset out of nowhere, which is not the case.
Yeah.
But also, I understand why you're unsure and conflicted. You haven't been given tools. When I'm like, there's 40 things I could do with this fearful cat to make this less stressful and more efficient and all that lovely stuff.
Do you have cats yourself?
Yes, I have 4 cats.
Tell us about it.
So unfortunately, I recently lost one of my cats. I'm not gonna cry.
Oh.
They're all tattooed on me.
Look at that. Look at that.
So
I was gonna ask you about your cat.
Right.
this is my cat, unfortunately, who passed away, Cupcake, and there's my little
Cupcake.
semicolon,
Oh.
which is a mental health thing. I had a cat named Cupcake,
Yeah.
Chocolate Chip, Jelly Bean, Malt, and Norman Squeakers, and they're all super seniors. I didn't plan this life because my dog's a super senior too.
Oh, my.
My vet's like, who's my good friend? She's like, girl. And I'm like, it wasn't, because interestingly enough, we were talking about this, all my cats came to me.
Yeah.
Mm.
And like, I didn't see, I love them. I wouldn't have it no
That's-
other way. But that's another thing. Most people, when clients are like, where'd you get your cat? I found them outside, which also tells us,
I think cats find people.
yeah.
Yes,
Right.
that's very true. That's very true.
I like that. I like that. You have a hard cat?
What do you mean? Oh, I see. I have cats with lots of medical management issue. Like they're on lots of medical management, and my partner is not a veterinary professional. Bless all you people who are couples and you're both in the field.
Oh, listen, I'm here.
Sorry, bless y'all.
I'm here
Bless
to tell
y'all.
you, it doesn't work. My husband's a vet. And as a team, when we have to medicate our pets, we actually magnify our uselessness.
But that's just
Big
normal,
fail.
like, right? So he's afraid of needles and things like that. But I'm working on his comfort level with those separately away from the
Try
cats.
clicker training.
It works. But thankfully all my animals are very like cooperatively
Yeah.
cared for.
Yeah.
So even though I'm gone, because I
Yeah.
travel a
They
lot for
can
work,
still get the care.
my partner can easily medicate them, and which also, I have caregivers who are like, I can't leave because
Absolutely. I'll never have a vacation again.
and there are solutions to
absolutely.
that. This
Right,
is me
right,
giving the
And so what was the answer to the hard cat question?
point.
It's okay. You can have more than one.
She's very distracting.
So probably Chip.
Shit.
So his name is Chocolate Chip. He was my first cat as an adult. He was actually my first pet as an adult, and he's never gonna leave me ever. Oh my gosh. Because he's like 15 now. But
Oh.
age is not a disease.
Age
It's
is not a
just
disease.
a number.
Right.
They are more prone to disease processes though.
Is he brown?
No, he's actually black.
So how did he get chocolate chip as a name?
I don't know. Because obviously you probably saw a pattern. Cupcake, Bean.
Yeah.
Norman Squeakers was a foster that
Okay, so
we kept.
there's a lot of dessert and
Yeah.
treat things. I sense a theme.
I have a pet that's called after a chocolate chip.
Oh, what? Chocolate chip?
Chippy.
Oh, that's so cute.
You didn't name him after a chocolate
Yes,
chip.
as a matter of fact, there were three, fosters, and the person that fostered called them Brownie, Chippy,
Oh, so you
and
kept
Rocky.
his name.
right?
Oh,
all
I didn't realize
after
he
ice
came
cream.
with the name.
Yes,
Oh, they're ice cream names.
yes.
Oh, it's cute when they get the
Oh.
litters and they're like, this one's like, oh, I love it.
I always learn something
I
with these
know, right?
podcasts.
It's amazing. So,
Now I know how
but
Chippy got his
that
name.
also brings us to the end of the first podcast, and it goes so fast.
It does really.
So fast. So I have like 100 questions left.
Oh, well, that's why we do part 2.
This is the Purr Podcast, where we talk cats, laugh a lot, and learn something new every episode. Together, we bring you the latest updates, surprising cases, expert interviews, and just a touch of chaos, because nothing with cats ever goes as planned.
So whether you're a seasoned veterinary pro, a new grad, or you're just here for the cat puns, you've come to the right place.